Welcome to the Explainer. Look, if you're a parent, you know the drill. It's 3 a.m., the baby is crying, and you're staring at that little silicone pacifier wondering, is this actually okay to use? Well, we are cutting through all the conflicting advice today and diving straight into the Mayo Clinic's guidelines to get you the actual facts.
Here is our game plan today. We're going to cover the pacifier dilemma, weigh the pros, understand the cons, lay out some safe pacifier guidelines, and finally, talk about pulling the plug.
All right, part 1, the pacifier dilemma. To binky or not to binky?
It really is the ultimate question, right? Every sleep-deprived parent asks themselves this while pacing the hallway in the middle of the night. Are pacifiers actually okay for your baby, or are you just setting yourself up for years of bad habits and massive dental bills down the road?
Well, first things first, the Mayo Clinic wants to validate exactly what your baby is experiencing. Babies are born with a super powerful, completely innate sucking reflex. Seriously, some babies even suck their thumbs while they're still in the womb. And this reflex isn't just about getting food. The physical act of sucking gives them this immense, natural soothing relief. It's literally a built-in biological mechanism for comfort.
Moving on to part 2, weighing the pros and looking at the undeniable benefits. There are some fantastic, undeniable quality of life benefits here. For starters, a pacifier simply soothes a fussy baby who just needs to suck on something to calm down. It's also an amazing short-term distraction during painful stuff, like getting shots or blood tests. Struggling with naps? A pacifier can absolutely be the magic trick that helps them finally drift off. Plus, if you're flying, it eases that terrible ear pressure. Babies can't exactly pop their ears by yawning like we do, so sucking really helps equalize things. And here is a huge practical bonus. Pacifiers are disposable. When it's time to quit, you just toss them in the trash. You definitely can't do that with a thumb.
But here is a truly crucial, potentially life-saving medical benefit. Research actually shows that offering a pacifier during sleep times, so we're talking both nap time and bedtime, might actively lower the risk of sudden infant death syndrome, or SIDS. This is a massive win in the pro column, and honestly, it's often the main reason pediatricians tell parents to introduce one in the first place.
What's really fascinating is how perfectly nature timed this. The Mayo Clinic points out that the highest risk for SIDS happens right between birth and 6 months. Coincidentally, the risk of middle ear infections, which can sometimes be triggered by pacifiers, is at its absolute lowest during that exact same window. So you basically get this perfect 6-month grace period where the biggest benefit overlaps completely with the lowest risk.
Okay, let's flip the script. Part 3, understanding the cons and the potential pitfalls.
So what's the catch? Well, there are a few pitfalls you definitely need to manage. First up is sleep dependency. If your baby absolutely needs that pacifier to fall asleep, they're probably going to wake up crying in the middle of the night the second it falls out. Also, as they get a bit older, the risk of those middle ear infections we just talked about does go up. Keep it around for years, and you're looking at long-term dental misalignments. Oh, and there is a potential for breastfeeding disruption, but hold on, there's a really important caveat to that one.
And here is that caveat, because the medical data is super clear on this now. For years, people swore pacifiers ruin breastfeeding, but recent research confirms that pacifiers absolutely will not disrupt the length or success of breastfeeding as long as you wait. You just have to wait to introduce one until your baby's nursing and latch routine are firmly and successfully established. Timing is literally everything here.
That brings us to part 4, safe pacifier guidelines. Consider this your do's and don'ts user manual.
When it comes to safety, you need a mental playbook. For the do's, definitely buy the one-piece, dishwasher-safe ones. Always let your baby set the pace. If they're not into it, no big deal. And try to use it mostly after or between feedings. Now for the don'ts. Avoid two-piece pacifiers completely, because they can break apart and become a terrifying choking hazard. Never force it into their mouth. Absolutely never dip it in sugar or something sweet. That is terrible for their emerging teeth. And finally, don't make it your very first line of defense for soothing. Try rocking them or shifting their position before you just plug them up with silicone.
Hygiene is also incredibly critical early on. You see, a baby's immune system isn't fully formed until they're about 6 months old, so boiling those pacifiers or running them through a super hot dishwasher is mandatory. And please definitely listen to the Mayo Clinic on this one. If a pacifier drops on the floor, do not clean it by popping it into your own mouth. You might think you're helping, but adult mouths are packed with totally different bacteria, and you are literally just transferring your adult germs straight to your baby.
For everyday safety, just follow these 4 simple steps. 1. Replace them frequently. 2. Make sure you're using the right size for your baby's age. They really do come in different sizes for a reason. 3. Constantly check the silicone or latex for any signs of wear and tear, like if it's getting sticky or torn. And 4, never ever attach a pacifier to a long string or strap that could wrap around your baby's neck. Use those super short safety clips specifically designed for this.
All right, our final section, part 5, pulling the plug, the exit strategy.
When you map out the life cycle of this whole pacifier habit, you can see exactly when the risks start outweighing the benefits. From birth to 6 months, it is highly beneficial for SIDS prevention. But hitting that sweet spot between 6 to 12 months is actually the absolute ideal weaning window. Stopping right there helps prevent those rising ear infection rates, because if you miss that window, you're heading straight into the danger zone.
2 years old is the absolute hard maximum age the Mayo Clinic recommends for pacifier use. The research is super clear here. By age 2, harmful dental effects, structural changes to the roof of the mouth, and misaligned teeth really start to set in. So, if your little one is coming up on their 2nd birthday, it is officially time to pull the plug.
But hey, you don't have to do this alone, and it definitely shouldn't feel like a punishment. Be supportive. A lot of kids actually drop the habit on their own, but if yours is having a tough time, bring on the positive reinforcement. Praise them big time when they choose not to use it. And look, if you're hitting a wall, do not hesitate to ask your pediatrician or pediatric dentist for help. They guide parents through age-appropriate weaning strategies literally every single day.
So armed with these solid Mayo Clinic guidelines, think about your own soothing toolkit tonight. Before you instinctively grab that pacifier the next time your baby fusses, what other strategy could you confidently try first? Maybe a quick change of scenery or a little gentle rocking. Remember, understanding the tool makes you the master of it, not dependent on it. Thanks for hanging out for this explainer, and we'll see you next time.